How do genes affect early signs of dementia? Genes can influence when and how early signs of dementia show up, especially in cases like Alzheimer's disease. While many people think of dementia as something that happens with age, genetics can play a big role in shaping that timeline. Some genes increase the risk of developing dementia, while others can cause it to appear much earlier. One important group of genes are the rare mutations that cause early-onset Alzheimer's disease. These mutations are found in less than 10% of all Alzheimer's cases. They usually lead to symptoms before age 65, sometimes even in the 40s or 50s. The three main genes involved are called AP, SUN1, and SUN2. When someone inherits a mutation in one of these genes, it almost always leads to developing Alzheimer's at a younger age. These mutations cause abnormal processing of proteins in the brain, leading to the buildup of amyloid plaques, which are a hallmark of Alzheimer's. Because these mutations are highly penetrant, genetic testing can identify them in families with a history of early-onset dementia. However, knowing about these risks can be emotionally challenging, so genetic counseling is often recommended. In addition to rare mutations, common genetic variants also influence dementia risk and the age when symptoms might appear. The most well-known is the APOE gene, especially the APOE epsilon for variant. Carrying one copy of this gene increases the risk of developing late-onset Alzheimer's, which usually happens after age 65. If someone has two copies of APOE epsilon, their risk is even higher, and symptoms might show up earlier. But it's important to remember that having this gene does not mean a person will definitely develop dementia. It just increases the likelihood. Many other genes, over 100 identified so far, also contribute smaller effects, influencing susceptibility but not directly causing the disease. These genes often interact with lifestyle factors like blood pressure, diabetes, and heart health, which can also affect when early signs appear. Family history is another important factor. If a parent or sibling has dementia, your risk is higher because of shared genes and environment. Studies suggest that children of people with dementia may develop symptoms several years earlier than their relatives, indicating that genetics and possibly epigenetic factors influence the timing of early signs like memory loss or confusion. People with Down syndrome are also at higher risk because they have an extra copy of chromosome 21, which carries the AP gene. This increases their chance of developing early signs of Alzheimer's in their 50s or 60s. Ongoing research continues to uncover new genetic factors that might explain cases of early-onset dementia that don't fit the typical patterns. In summary, genes play a significant role in early signs of dementia by increasing the likelihood of developing the disease and affecting when symptoms like memory problems or confusion first appear. Rare gene mutations can cause early-onset familial Alzheimer's with a high certainty, while common variants like APOE epsilon modify risk and timing in the broader population. But genetics is just one piece of a complex puzzle that includes health, lifestyle, and environment. Understanding these genetic influences can help with early diagnosis, risk assessment, and potentially guiding future treatments aimed at delaying or managing symptoms. Always remember, if you have concerns about your risk or family history, consulting a healthcare professional is the best step to get personalized advice and support.